If you have rheumatoid arthritis, the foods you eat might be making your symptoms worse. Some common foods could be fueling the inflammation and pain you're experiencing. In today's video, we're covering the top foods you should avoid to help reduce inflammation and improve your RA symptoms. The food at number 5 is the worst one you're probably eating every day without realizing it. Stick around to learn which foods to steer clear of and how making simple changes to your diet can help you feel better. You won't want to miss this. First, we have alcohol. Alcohol has been a topic of debate when it comes to its impact on health, particularly in conditions like rheumatoid arthritis (RA). For those suffering from this autoimmune disease, the consequences of consuming alcohol can be significant. RA occurs when the immune system mistakenly attacks healthy joints, leading to inflammation, pain, and stiffness. While alcohol might offer temporary relief or a sense of relaxation, its long-term effects on the body, especially in those with rheumatoid arthritis, can make the condition worse. Understanding the relationship between alcohol and RA is essential for anyone managing this chronic disease. One of the primary ways alcohol worsens rheumatoid arthritis is through its effect on the immune system. Alcohol is known to weaken the immune system's ability to fight infections and can alter immune responses. In RA, where the immune system is already attacking the joints, alcohol can exacerbate this by making the body's immune response more erratic. This imbalance can lead to more intense flare-ups, increasing the overall severity of symptoms such as swelling and joint pain. Alcohol also contributes to inflammation in the body, which is one of the hallmark features of rheumatoid arthritis. Studies have shown that alcohol can increase the production of certain inflammatory cytokines, proteins that promote inflammation in the body. These inflammatory markers are already elevated in RA, and drinking alcohol can amplify this effect. The more inflamed the joints become, the more painful and difficult it is to manage the disease. Beyond just exacerbating inflammation, alcohol can also interfere with the medications commonly prescribed to manage rheumatoid arthritis. Nonsteroidal anti-inflammatory drugs, which are often used to alleviate RA pain, can cause stomach irritation or ulcers. When combined with alcohol, the risk of these side effects increases dramatically. The liver, which processes both alcohol and certain RA medications, can become overburdened, leading to potential liver damage and reduced effectiveness of the treatment. Another important factor to consider is how alcohol affects the liver's ability to process nutrients. People with rheumatoid arthritis are already at risk for malnutrition, partly due to the disease's impact on appetite and the body's inability to absorb nutrients properly. Alcohol can interfere with the liver's function, leading to deficiencies in essential nutrients like vitamin D, which is crucial for joint health and reducing inflammation. These deficiencies can worsen the progression of rheumatoid arthritis and contribute to weakened bones and joints. Alcohol consumption can also lead to dehydration, which is another factor that can worsen rheumatoid arthritis. Proper hydration is essential for maintaining joint lubrication and overall health, but alcohol has a diuretic effect, meaning it promotes the loss of water through increased urination. Dehydration can make the joints feel stiffer and more painful, and in the case of RA, it may increase the frequency of flare-ups. The gut plays a critical role in rheumatoid arthritis, as the health of the gut microbiome can influence inflammation levels in the body. Alcohol negatively impacts gut health by disrupting the balance of good and bad bacteria in the intestines. This imbalance can lead to leaky gut syndrome, where toxins from the gut leak into the bloodstream, triggering more inflammation. In turn, this inflammation can exacerbate the symptoms of rheumatoid arthritis, making it harder to manage the disease. Alcohol also contributes to weight gain, which can place additional strain on already inflamed joints. Those living with rheumatoid arthritis are often advised to maintain a healthy weight to reduce stress on the joints, particularly the knees, hips, and spine. Alcoholic drinks are high in empty calories, and excessive consumption can lead to weight gain, increasing the load on affected joints. This added pressure can make movement more difficult and painful. Finally, it's important to note that alcohol can have a direct impact on mental health, which is often a neglected aspect of managing rheumatoid arthritis. Chronic pain and inflammation from RA can lead to feelings of depression and anxiety. While alcohol might temporarily numb these feelings, it can ultimately make them worse. The depressant effects of alcohol can lower mood and reduce motivation to follow through with treatment plans, exercise, and other healthy behaviors that are important for managing rheumatoid arthritis. Next, we have caffeine. Caffeine, a stimulant found in coffee, tea, and many soft drinks, is widely consumed for its energizing effects. However, for those living with rheumatoid arthritis, RA, caffeine can pose several challenges. RA is an autoimmune disease in which the body's immune system mistakenly attacks the joints, leading to inflammation, pain, and long-term damage. Although caffeine might provide temporary relief by masking fatigue, its long-term effects on the body can worsen the symptoms of RA and complicate its management. Understanding how caffeine interacts with rheumatoid arthritis is crucial for those looking to manage the condition effectively. One of the primary ways caffeine affects rheumatoid arthritis is through its impact on inflammation. Caffeine has been shown to increase the production of certain inflammatory markers in the body. RA is characterized by excessive inflammation in the joints, and any substance that further elevates these inflammatory markers can exacerbate the disease. As caffeine stimulates the central nervous system, it can indirectly increase inflammation in the body, contributing to more pain, swelling, and discomfort in the affected joints. Another significant issue with caffeine consumption in individuals with RA is its effect on calcium absorption. Caffeine has been found to interfere with the body's ability to absorb calcium, which is essential for maintaining strong bones and healthy joints. People with rheumatoid arthritis are already at a higher risk of developing osteoporosis and bone fractures due to the inflammation and medications associated with the condition. Reduced calcium absorption, caused by excessive caffeine intake, can make bones even more fragile and susceptible to damage, increasing the risk of fractures. Caffeine is also known to contribute to dehydration, which can be particularly problematic for individuals with rheumatoid arthritis. Hydration plays a key role in maintaining joint health, as water helps to lubricate the joints, reducing stiffness and improving flexibility. Caffeine has a diuretic effect, which means it increases urine production and leads to fluid loss. This can result in dehydration, making the joints feel even stiffer and more painful, while also potentially triggering more frequent flare-ups of RA symptoms. Beyond hydration, caffeine can interfere with sleep quality, which is another important factor in managing rheumatoid arthritis. Individuals with RA already struggle with sleep disturbances due to pain and inflammation. While caffeine can help improve alertness during the day, consuming it too close to bedtime can disrupt sleep patterns. Poor sleep quality leads to increased pain sensitivity, fatigue, and difficulty managing stress, all of which can make rheumatoid arthritis symptoms worse. This creates a vicious cycle where sleep problems fuel RA flare-ups, and caffeine consumption exacerbates the cycle. Caffeine also impacts the adrenal glands, which are responsible for producing stress hormones like cortisol. Chronic consumption of caffeine can overstimulate the adrenal glands, leading to increased levels of cortisol in the body. While cortisol is a natural stress hormone, prolonged high levels can contribute to inflammation and exacerbate autoimmune conditions like rheumatoid arthritis. By interfering with the adrenal glands and hormone production, caffeine can worsen the inflammatory processes that drive RA. There is also evidence to suggest that caffeine affects the balance of gut bacteria, which plays a role in regulating inflammation. The gut microbiome has been shown to influence immune function, and any disruption in its balance can exacerbate autoimmune diseases like RA. Caffeine may alter the composition of gut bacteria, promoting the growth of harmful bacteria that can trigger an immune response and increase inflammation. This imbalance can aggravate the symptoms of rheumatoid arthritis, making it more difficult to control the disease. Caffeine can also interfere with certain medications commonly used to treat rheumatoid arthritis. Many people with RA rely on drugs like methotrexate or biologics to help manage the disease. Caffeine may reduce the effectiveness of some of these medications by affecting the metabolism or absorption of the drugs. Additionally, caffeine can increase the risk of side effects, such as gastrointestinal distress, when combined with certain RA medications. This interaction can make it harder for individuals with RA to maintain consistent, effective treatment regimens. Furthermore, caffeine can influence mood and emotional health, which are often impacted by chronic conditions like rheumatoid arthritis. The stress and frustration of living with a chronic illness can contribute to feelings of depression and anxiety. While caffeine may temporarily boost mood, excessive consumption can lead to jitteriness, anxiety, and even irritability. For someone already managing the emotional toll of RA, these mood swings can further complicate the management of the condition, leading to additional stress that exacerbates inflammation. One more significant concern is that caffeine can lead to increased heart rate and blood pressure. People with rheumatoid arthritis are at a higher risk of developing cardiovascular problems due to the chronic inflammation that RA causes. Elevated heart rate and blood pressure can put additional strain on the cardiovascular system, increasing the risk of heart disease. Since caffeine is a stimulant that can elevate both heart rate and blood pressure, it may increase the risk of cardiovascular complications for those with RA. Next, we have dairy products. Dairy products, including milk, cheese, and yogurt, are often considered healthy foods due to their calcium content and other essential nutrients. However, for people suffering from rheumatoid arthritis (RA), these seemingly harmless foods can actually exacerbate the symptoms of the condition. RA is an autoimmune disease in which the body's immune system attacks its own joints, leading to inflammation, pain, and stiffness. While not everyone with RA is sensitive to dairy, there is evidence that dairy consumption can worsen the disease and make managing symptoms more difficult. One of the main ways dairy products affect rheumatoid arthritis is through their protein content, specifically a protein called casein. Casein, which is found in significant amounts in cow's milk and dairy products, can trigger an immune response in some individuals. For people with rheumatoid arthritis, this immune response can lead to an increase in inflammation in the body, which is already a significant issue with the condition. Increased inflammation can result in more pain, swelling, and stiffness in the joints, making it harder to manage RA symptoms effectively. Dairy products are also known to contain arachidonic acid, a type of omega-6 fatty acid that is often found in animal-based foods. While omega-6 fatty acids are essential for the body in moderation, excessive amounts can contribute to inflammation. Arachidonic acid is converted into inflammatory compounds in the body, known as eicosanoids, which can increase joint inflammation in individuals with RA. Because dairy products are a major source of arachidonic acid, consuming them can potentially worsen the chronic inflammation associated with rheumatoid arthritis. In addition to promoting inflammation, dairy can also affect the gut microbiome, which plays a crucial role in regulating the immune system. Research has shown that the gut bacteria of individuals with autoimmune diseases like RA are often imbalanced, contributing to the body's inflammatory response. Dairy products, particularly those with added hormones and antibiotics, can disrupt the balance of beneficial bacteria in the gut. This imbalance can lead to increased inflammation throughout the body, potentially aggravating RA symptoms and making it harder for the body to manage the disease effectively. For some people with rheumatoid arthritis, dairy may also be a trigger for food allergies or intolerances. Lactose intolerance is a common condition in which individuals have difficulty digesting lactose, the sugar found in milk. While lactose intolerance doesn't directly cause inflammation, it can lead to digestive distress, bloating, and discomfort. In individuals with RA, these gastrointestinal symptoms can compound the challenges of managing the disease, leading to additional discomfort and stress on the body, which may indirectly worsen RA symptoms. Dairy is also known to be high in saturated fats, particularly in full-fat products like cheese and butter. Saturated fats have been linked to increased levels of systemic inflammation in the body. Since rheumatoid arthritis is already driven by inflammation, consuming large amounts of saturated fats can exacerbate the inflammatory response and make symptoms like joint pain and stiffness more pronounced. Reducing saturated fat intake can be an important step in managing RA symptoms and improving overall joint health. Another factor to consider is that dairy can impact bone health. While dairy products are often promoted for their calcium content, they may not always be beneficial for individuals with rheumatoid arthritis. In fact, some studies suggest that excessive dairy intake can actually contribute to the loss of bone density in people with RA. This is particularly concerning since individuals with rheumatoid arthritis are already at a higher risk of developing osteoporosis and bone fractures due to inflammation and the long-term use of corticosteroids. Consuming large amounts of dairy may exacerbate this issue, leading to weaker bones and an increased risk of fractures. Dairy products can also cause an increase in mucus production, which may worsen symptoms of rheumatoid arthritis in some people. The body naturally produces mucus as part of its immune response to infections and irritants, but excess mucus production can lead to congestion and discomfort. For individuals with RA, increased mucus production can contribute to a sense of inflammation and discomfort throughout the body, which may make it more difficult to manage joint pain and stiffness. Furthermore, some dairy products contain added sugars, particularly flavored yogurts and milk-based beverages. These added sugars can contribute to increased inflammation in the body, as high sugar intake has been linked to elevated levels of inflammatory markers. When combined with the other inflammatory properties of dairy, consuming products with added sugars can further exacerbate the symptoms of rheumatoid arthritis and make it harder to maintain overall health and wellness. Next, we have fried foods. Fried foods are a staple in many people's diets, but they can be highly detrimental to those living with rheumatoid arthritis, RA. RA is an autoimmune disease that causes inflammation in the joints, leading to pain, stiffness, and swelling. Fried foods, although tasty, have properties that can exacerbate the symptoms of RA and contribute to further damage in the body. Understanding how fried foods interact with the body, particularly in those with rheumatoid arthritis, is key to managing the condition effectively. One of the primary ways that fried foods can worsen rheumatoid arthritis is through their high content of trans fats. Trans fats are artificially created fats that are found in many fried foods. These fats are known to increase inflammation in the body. Since RA is driven by inflammation in the joints, the consumption of trans fats can directly worsen the disease. Trans fats trigger the production of inflammatory markers in the body, which leads to heightened pain, swelling, and stiffness in the joints. This increase in inflammation makes it more difficult to manage RA symptoms. In addition to trans fats, fried foods are often cooked at high temperatures, which causes the formation of harmful compounds like advanced glycation end products, AGEs. AGEs are molecules that form when sugars and proteins or fats interact under high heat. These compounds can damage tissues throughout the body and have been shown to contribute to chronic inflammation. For people with rheumatoid arthritis, the presence of AGEs in fried foods can further intensify the inflammation in the joints, worsening pain and discomfort. AGEs also play a role in promoting oxidative stress, which can damage cells and tissues, exacerbating RA symptoms over time. The oils used for frying foods are another contributing factor to the harmful effects on rheumatoid arthritis. Most fried foods are cooked in vegetable oils, which are high in omega-6 fatty acids. While omega-6 fatty acids are essential in small amounts, an imbalance between omega-6 and omega-3 fatty acids in the diet can lead to increased inflammation. Omega-6 fatty acids promote the production of pro-inflammatory molecules, which can aggravate conditions like rheumatoid arthritis. This imbalance can make it more difficult for the body to manage inflammation, leading to more frequent flare-ups and worsening joint pain. Fried foods are also often high in refined carbohydrates and sugars, which are known to promote inflammation in the body. Many fried foods, such as battered chicken, fries, and donuts, are made with white flour and sugar, both of which can lead to spikes in blood sugar levels. Elevated blood sugar levels increase the production of inflammatory compounds like cytokines, which can further increase joint inflammation in people with rheumatoid arthritis. Consuming fried foods that are rich in refined sugars and carbs can make RA symptoms more severe, as these foods fuel the inflammatory processes in the body. Moreover, fried foods can contribute to weight gain, which places additional stress on the joints, particularly those affected by rheumatoid arthritis. Extra weight can increase the load on already inflamed joints, leading to more pain and stiffness. The combination of poor food choices and weight gain creates a cycle where the joints become even more vulnerable to damage. Managing weight is an important aspect of RA treatment, as excess weight can worsen joint pain and reduce mobility, making it harder to perform daily tasks. The process of frying foods also reduces the nutritional value of the food. Many of the beneficial nutrients found in fresh foods, such as vitamins, minerals, and antioxidants, are destroyed when foods are fried at high temperatures. For individuals with rheumatoid arthritis, maintaining a nutrient-rich diet is essential for supporting the immune system and reducing inflammation. By regularly consuming fried foods, people with RA may be depriving their bodies of essential nutrients that could help combat the inflammation and pain associated with the disease. Additionally, the consumption of fried foods can increase the risk of other health conditions that can further complicate the management of rheumatoid arthritis. Fried foods have been linked to an increased risk of heart disease, diabetes, and high blood pressure, all of which are common comorbidities for people with RA. These health issues can make it more difficult to manage rheumatoid arthritis effectively and may even lead to more severe joint damage. The overall burden on the body caused by the consumption of fried foods can increase the challenges of managing both RA and other health conditions simultaneously. Fried foods can also trigger the release of cortisol, the body's primary stress hormone. While cortisol is essential in small amounts, chronic activation of the stress response can have negative effects on the body, especially for those with autoimmune diseases like rheumatoid arthritis. Elevated cortisol levels have been shown to contribute to increased inflammation, which can exacerbate RA symptoms. Stress can also lower pain tolerance, making the discomfort from rheumatoid arthritis more difficult to manage. By promoting the release of cortisol, fried foods may unknowingly contribute to the stress and inflammation that worsen RA symptoms. In terms of gut health, fried foods can disrupt the balance of the gut microbiome, which plays a crucial role in regulating immune function and inflammation. Studies have shown that a diet high in unhealthy fats, such as those found in fried foods, can alter the composition of gut bacteria in a way that promotes inflammation. Since gut health is closely tied to the body's immune response, an unhealthy gut microbiome can trigger or worsen autoimmune conditions like rheumatoid arthritis. The long-term consumption of fried foods can lead to chronic gut imbalances that contribute to the ongoing inflammation seen in RA. Next, we have nightshade vegetables. Nightshade vegetables, including tomatoes, potatoes, peppers, and eggplants, are commonly consumed in many diets due to their rich flavors and versatility. However, for individuals with rheumatoid arthritis (RA), these vegetables may not be as beneficial as they seem. RA is an autoimmune disease where the immune system attacks the body's joints, causing inflammation, pain, and stiffness. While nightshades are packed with essential vitamins and antioxidants, they also contain compounds that can exacerbate RA symptoms and make managing the condition more challenging. One of the primary culprits in nightshade vegetables is a group of naturally occurring chemical compounds known as alkaloids. The most common alkaloid in nightshades is solanine, which is found in tomatoes, potatoes, and eggplants. Solanine is believed to affect the nervous system and may trigger inflammatory responses in some individuals. For those with rheumatoid arthritis, this can lead to an increase in joint inflammation and pain, making the condition more difficult to manage. The presence of solanine in nightshades can, therefore, contribute to the worsening of RA symptoms. Another way nightshade vegetables affect rheumatoid arthritis is through their potential to increase inflammation in the body. Nightshades contain a type of protein called lectins, which are also found in other foods like beans and grains. Lectins are known to have the ability to bind to the gut lining and disrupt the intestinal barrier. In individuals with compromised immune systems, such as those with RA, this disruption can lead to increased intestinal permeability, also known as leaky gut. When the gut is permeable, harmful substances can leak into the bloodstream, triggering an immune response and increasing overall inflammation in the body. This inflammation can then exacerbate RA symptoms, such as joint pain and stiffness. While many nightshade vegetables are a rich source of antioxidants like vitamin C and vitamin A, these antioxidants can sometimes have an adverse effect on people with rheumatoid arthritis. Some studies suggest that for certain individuals with RA, consuming too many nightshade vegetables can lead to an overload of these antioxidants, which can overwhelm the body's ability to process them. This overload may trigger an increase in oxidative stress, which can damage cells and tissues in the body. For individuals with rheumatoid arthritis, increased oxidative stress can lead to more severe inflammation and joint damage. Nightshades, particularly tomatoes and peppers, also contain compounds known as capsaicin and tomatin. These compounds are responsible for the spiciness and bitter flavor in some nightshade vegetables. For some people with rheumatoid arthritis, capsaicin and tomatine can irritate the gut lining and contribute to digestive distress. When the digestive system is under stress, it can have a negative impact on overall health, potentially worsening RA symptoms. Digestive issues, including bloating and discomfort, can make managing the condition more difficult and lead to increased inflammation throughout the body. Additionally, nightshades are high in simple carbohydrates, especially potatoes. These carbohydrates can cause a spike in blood sugar levels, leading to an increase in insulin production. High levels of insulin have been linked to increased inflammation in the body, which can worsen the pain and swelling associated with rheumatoid arthritis. As RA is already driven by inflammation, consuming foods that further contribute to this process can make it harder to manage the condition effectively. Some people with rheumatoid arthritis may have a sensitivity to nightshade vegetables, even if they are not allergic. This sensitivity can manifest as an intolerance to certain compounds found in nightshades, leading to gastrointestinal issues such as bloating, gas, and diarrhea. These symptoms can put additional stress on the body and potentially trigger an inflammatory response that affects the joints. For those with RA, the gut and joints are closely connected, and any irritation in the gut can worsen joint inflammation and pain. The way nightshade vegetables are prepared can also impact their effect on rheumatoid arthritis. When potatoes, for example, are fried or processed into chips, they become much higher in unhealthy fats and calories. These added fats can promote inflammation in the body, which may aggravate RA symptoms. Additionally, cooking nightshades at high temperatures can sometimes alter their chemical composition, potentially increasing the concentration of alkaloids like solanine. This makes it more difficult to control the inflammatory response associated with RA. Nightshades can also interfere with the body's ability to absorb certain minerals, including calcium and magnesium. These minerals are essential for maintaining bone health, especially for people with rheumatoid arthritis, as they are at higher risk for osteoporosis and bone loss due to inflammation and long-term medication use. The presence of alkaloids and other compounds in nightshades may hinder the absorption of these vital nutrients, leading to weaker bones and an increased risk of fractures. For individuals with RA, maintaining strong bones is crucial, so consuming foods that impair mineral absorption can have long-term negative effects on health. Last, we have processed meats. Processed meats, such as bacon, sausages, deli meats, and hot dogs, are common components of many diets, but they can have a significant negative impact on those living with rheumatoid arthritis, RA. RA is an autoimmune disease where the immune system mistakenly attacks the body's joints, leading to inflammation, pain, and stiffness. While processed meats may be convenient and flavorful, they contain several properties that can exacerbate the symptoms of RA and contribute to long-term joint damage. One of the most concerning aspects of processed meats is their high content of saturated fats. Saturated fats are known to promote inflammation in the body. In individuals with RA, whose immune system is already causing inflammation in the joints, consuming foods that increase inflammation can make symptoms worse. Saturated fats can trigger the production of pro-inflammatory molecules, which intensify pain, swelling, and stiffness in the affected joints. This can lead to more frequent flare-ups and make managing RA more challenging over time. Processed meats also contain nitrates and nitrites, which are commonly used as preservatives to extend shelf life and enhance color. When consumed, nitrates and nitrites can be converted into harmful compounds called nitrosamines in the body. Nitrosamines have been shown to promote inflammation and oxidative stress, both of which can worsen the symptoms of rheumatoid arthritis. These compounds also have a damaging effect on the tissues, increasing the overall inflammation and potentially contributing to the progressive joint damage seen in RA. Another concern with processed meats is their high salt content. Excessive salt intake has been linked to increased inflammation, which can make rheumatoid arthritis symptoms more severe. High sodium levels can cause the body to retain water, leading to swelling in the joints and exacerbating the pain and stiffness associated with RA. Additionally, a high-salt diet can increase blood pressure, which places further strain on the cardiovascular system and complicates the management of RA. Since people with RA are already at a higher risk for cardiovascular issues, consuming processed meats regularly may increase the likelihood of developing additional health problems. The methods used to process meats also involve smoking, curing, and other forms of heat treatment, which can create toxic compounds like polycyclic aromatic hydrocarbons, PAHs. PAHs are formed when meat is cooked at high temperatures, such as during grilling or smoking, and have been shown to increase inflammation in the body. For individuals with rheumatoid arthritis, these inflammatory compounds can exacerbate joint pain and swelling. Consuming processed meats frequently, especially those that are grilled or smoked, can contribute to a buildup of PAHs in the body, further promoting inflammation and worsening RA symptoms. Additionally, processed meats are often high in advanced glycation end products, AGEs, which are harmful compounds that form when proteins or fats react with sugars in the bloodstream. AGEs are known to promote inflammation and oxidative stress, both of which are detrimental to individuals with rheumatoid arthritis. Since RA is already characterized by chronic inflammation in the joints, the presence of AGEs in processed meats can worsen symptoms, accelerate joint damage, and increase the risk of complications associated with the disease. AGEs also contribute to tissue damage and can negatively affect the cartilage and bones in the joints, making it harder for people with RA to maintain mobility and function. Processed meats are typically low in beneficial nutrients that are essential for individuals with rheumatoid arthritis. For example, they lack anti-inflammatory compounds like omega-3 fatty acids, which are found in fatty fish and other healthy sources. Omega-3s help reduce inflammation in the body and support joint health. Without adequate omega-3s and other anti-inflammatory nutrients, the body may struggle to control the inflammation associated with RA. By choosing processed meats over more nutrient-dense options, individuals with RA may be depriving themselves of the essential nutrients needed to manage their condition effectively. In addition to lacking essential nutrients, processed meats are often high in calories, which can contribute to weight gain. For individuals with rheumatoid arthritis, carrying excess weight can put additional strain on the joints, particularly those affected by the disease. Extra weight can increase the pressure on already inflamed joints, leading to more pain and stiffness. By consuming processed meats, which are calorie-dense and nutritionally poor, individuals with RA may unintentionally contribute to weight gain, worsening joint pain, and reducing mobility. Processed meats also contain artificial additives and flavor enhancers, such as monosodium glutamate, MSG, which can trigger inflammatory responses in some individuals. These additives are used to enhance the taste and shelf life of processed meats, but can lead to an increase in the production of pro-inflammatory cytokines in the body. For those with RA, the consumption of processed meats containing these additives can exacerbate joint inflammation and contribute to more frequent flare-ups. By reducing or eliminating processed meats from the diet, individuals with RA may be able to reduce their exposure to these inflammatory triggers and experience relief from symptoms.